A number of drop-in centers for people experiencing homelessness across the city are reporting a nearly 300% increase in overdoses since the Ford government closed 9 supervised consumption sites back in April.
And so that is very hard on drop-in centers that are dealing with that without resources or training to do that.
The data comes from the Toronto Drop-In Network, a coalition of organizations running 56 centers across the city for vulnerable populations.
So we're not surprised.
Bill Sinclair with the neighborhood group Community Services says advocates warned this would happen when the province banned consumption sites within 200 meters of a school or daycare on April 1st. As a result, 9 sites converted to an abstinence-based model dubbed Homelessness and Addiction Recovery Treatment, or HEART hubs. But the Kensington Market overdose prevention site next to a childcare center remains open thanks to a charter challenge and private funding from donors. Sinclair says the site has seen a small increase, but people are making their own safety plans.
There's been a long-term trend of people using different substances to try to be safer, or using differently, like smoking rather than injecting.
Advocate Lorraine Lamb says the burden of responsibility to respond to overdoses is now on everyone in public spaces.
You're going to have people who are riding transit possibly using. You're going to have people working in coffee shops, librarians, shopping center staff responding to overdoses. And I think that puts everybody at risk.
Ontario's Minister of Health tells City News the new law was in response to serious safety concerns raised by families about the presence of drug injection sites in communities.
People are right to be alarmed and upset and concerned that the quality of life of our neighborhoods are being threatened by poverty, by homelessness, by the lack of resources and supports. But supervised consumption sites are not causing the problem.
The province says HEART hubs are part of the solution. Quote, we are investing $550 million to build a total of 28 new HEART hubs across the province that will provide people facing mental health challenges with 24/7 support to help them break the cycle of addiction. According to Ontario's chief coroner, suspected drug-related deaths since the sites were closed are down 11% in comparison to the 3 months prior. City data also shows that Toronto paramedics are receiving less calls for overdoses. In Kensington Market, Michelle Mackey, City News.